From MTN News, you're watching Montana This Morning.
The COVID vaccine will start to become available after the first of the year. New this morning, learn who will qualify to get it first in Montana and how soon it will be available to the general public.
And when COVID-19 is behind you, what happens then? A Butte couple survived the virus, but they say they are still feeling its impact.
It is now 6:30 on this Tuesday. Chet Lehman, Holly Brantley, Matt Elwell with you here as we're in the home slide towards Thanksgiving.
Yeah. Yes, sir.
All of you are looking out for each other out there. As weather's going to be nice.
Weather's going to, overall, it will be nice. We do have some snow in the forecast as we lead into Thanksgiving. It wouldn't be Montana Thanksgiving without that. But our temperatures this morning really very pleasant, into the 20s for most of us. 14 in West Yellowstone. We do have a little bit of thin cloud cover in place early on in the day. I expect to see sunny skies through most of the afternoon. That should push those daytime highs near the 40-degree mark in Bozeman. Pretty close in Butte as well, but again, just a touch cooler for today. Ooh, the sneak peek. It does look like we have some snow in the forecast. We're going to break it all down for you coming up in just a few minutes.
I love it when you do subliminal weather. I think it's super cool. 6:31 now, our top story this half hour. City County Health Department says 3 more people in Gallatin County have died because of complications due to COVID-19.
Health officials say the 3 people were a woman in her 70s and 2 women in their 80s. All 3 died earlier this month, with health officials adding that the health department received the official death certificates recently that attributed their deaths to COVID-19. Silver Bow County also reports 1 new death, a resident at Butte's Continental Care and Rehabilitation long-term facility.
Well, there is hope that a COVID vaccine will be available soon, but a lot of questions about how the process will work once that happens.
Now the Montana Department of Health and Human Services says a statewide team will help communicate those answers. The state external COVID-19 vaccination plan coordination team, made up of Montana medical, tribal, government, and community leaders, will also give feedback as the process rolls out. Montanans need to realize no matter what happens, it won't be an instant fix.
This first initial round of vaccine, once it becomes available next month, will be available on a limited basis to the frontline workers, the frontline healthcare workers, those at most risk for COVID, and things like that. And so for most Montanans, it won't be available until later on in 2021.
Now, the draft plan is to distribute the vaccine in a 3-phase approach. Phase 1, within the first 2 months after it becomes available. This goes to targeted critical workforce. That includes essential responders and people at the highest risk. Phase 2, that's between 3 and 6 months out, expanding dispensing. This is the second dosing for Phase 1 recipients and first dosing for prioritized groups. Phase 3, 6 months and beyond, expand to normalized distribution and public dispensing. At this point, it's believed there will be a sufficient supply. First Zoom call meeting with the new coordination team set to take place later today.
Well, local health departments across the state added 21 new COVID-19 deaths late yesterday. Gallatin County now totals 16 total deaths, and Silver Bow's latest report brings it to 26 deaths. Montana's toll is now up to 644 statewide. Since Sunday night, Cascade County added 9 deaths, while Yellowstone County, Lake County, Chautauqua County, and Missoula County each added 1. Ravalli adds 3 deaths. You can see all of the active cases counts in each of our followed counties there. Gallatin County, 1,160 active cases. Silver Bow County, 554 active cases.
Well, more than 100 traveling nurses and respiratory therapists have arrived in Montana to help fill critical staffing shortages at Montana's hospitals because of the COVID-19 surge, and many more are on the way. Montana Governor Steve Bullock says the state has contracted with a Seattle area firm to bring the badly needed personnel into Montana. 110 medical staffers arrived through last weekend. Another 170 are expected to be here by the end of this week. Most of the help being sent to the big hospitals in Billings, Kalispell, and Great Falls, but they're also going to hospitals in Missoula, Butte, Bozeman, and Livingston. Montana National Guard also activating 58 members to help with non-medical duties at 5 of the state's larger hospitals. Hospitals facing critical staff shortages right now. Many staffers have had to quarantine and can't work, either because of contracting COVID-19 or because they've been in contact with those who have it. Governor Bullock's office says it expects that federal funds ultimately will pay the cost of the temporary medical help staffing.
Well, the holidays are a busy time for airports as people travel to spend time with family. Check out this time lapse from the Bozeman Yellowstone International Airport yesterday around noon. Airport administrators say they're prepared for the rush, but numbers still aren't what they normally see during this time of year. MTN News caught up with some passengers to see how their flying experience went.
Great. I mean, they were clean. I mean, everybody was out cleaning. Everybody had their masks on, but it was busy, packed. Like both airports at both times of day, midday in Denver, and then this early morning here in Chicago. So,
was it what you expected?
No, I expected it to be a lot quieter, but I guess people are trusting the cleaning process and that they're safe and making the right decision for their family. So
it was good. Wasn't a super crowded flight. Everybody's wearing their masks and social distancing, so everything seems pretty safe, generally speaking.
I was great. I thought everyone was really, I think the new precautions have made it actually kind of like easier, you know?
Director Brian Springer says Thanksgiving typically brings more roadway traffic versus air travel, adding Christmas is usually the big one.
6:36 now. The impact of COVID-19 after recovery varies for many, but for a Butte couple, they're still seeing and feeling it.
It's called post-viral syndrome, and it involves side effects that can bother people long after they've recovered from COVID-19.
MTN's John Amy spoke with a Butte man about how he and his wife are experiencing these side effects.
A couple from Butte were fortunate to recover from COVID-19 back in September, but their ordeal has not ended over 2 months later due to after effects known as post-viral syndrome. The negative side effects could plague them up to 8 months.
So it could be a real long time. It could go away on its own much sooner than that. We don't know.
Fred Cray said he recovered well from his illness, but his wife Elizabeth had a difficult time.
If she had gotten any worse and if her oxygen had dipped any lower, it would have been a hospital situation.
Once both had recovered after quarantine, Fred started feeling bouts of chronic fatigue and high blood pressure, as well as other unexpected issues.
I'm not a person who's prone to anxiety and panic, but I had a panic attack in the middle of the night. Is more and more being documented as a fairly common after effect.
His wife has been experiencing cognitive problems, such as not being able to recognize printed words.
They're treating it like she has a concussion because it has apparently caused some swelling in her brain.
The couple's doctor said medical professionals are learning more each day about post-viral syndrome as more people are experiencing these strange after effects.
It's made it difficult, but we try to go on as normally as possible, and we're optimistic that these after effects are temporary.
In Butte, John Amy, MTN News.
John tells us the couple encouraged people to follow safety protocols because this virus can have long-lasting effects.
Well, with the transition of power to a new president comes a flurry of new appointments. One of those departments affected is the U.S. Attorney's Office. Yesterday, U.S. Attorney for Montana Kurt Alm announced his resignation effective next week. Alm was recommended by Senator Steve Daines and nominated by President Trump in June of 2017 and confirmed a couple of months later. Because it's a political appointment, the president can keep or remove any U.S. attorney.
In Treasure State headlines, crews extinguished a hay fire that slowed traffic near Vaughan yesterday. The incident reported just after 1 o'clock near the Indian Hammer Veterinary Clinic on U.S. Highway 89. According to the Vaughan Fire Chief Jason McAllister, tractor hauling hay caught fire. Driver was able to get the tractor disconnected. Fortunately, no one injured in that blaze. With mild temperatures as we get closer to Thanksgiving, it's especially important to be fire aware if you are headed outdoors. That could have spread in a hurry. So
absolutely.
Good news they got that thing contained. Yep.
Yeah. Well, coming up on Montana this morning, Netflix makes a $1 billion announcement. We tell you what's next for the streaming service.
But first, let's check in with Gail King to see what's coming up at 7 o'clock on CBS This Morning.
Good morning to you. Ahead on CBS This Morning, the Trump administration finally recognizes Joe Biden as president-elect. We'll look at the importance of presidential transitions and how this transition is like nothing we've ever seen before. Also, COVID cases and hospitalizations continue to rise at a very alarming pace. We'll talk to New Jersey Governor Phil Murphy about the challenges of pleading with people not to travel during this holiday season. And Glenn Close will join us. The award-winning actress has been transforming herself for audiences for nearly half a century. How in her new role, she says she didn't even recognize herself in the mirror. I didn't recognize her either. Is that Glenn Close? Yeah, it is. We'll see you at 7 o'clock on the dot.